Now, coronavirus has been around, but this is a different strain, right?
So coronavirus has been around for a long time, can cause sore throat or runny nose, upper respiratory symptoms primarily, but sometimes new strains will get introduced into the population that are either more virulent, more able to cause disease, or are newer forms of the virus for which humans don't have as much immunity or as much protection as they've had against some of the prior strains that are circulating.
So how does coronavirus compare to other viruses? Is it the most deadly virus ever?
It's hard. I think we're learning a lot about coronavirus and through this COVID-19 outbreak. In general, I think they say the mortality rate for all people from the influenza virus is about 0.1%. And I've seen estimates with the current coronavirus anywhere from about that level up to about 3%. I think we're going to learn more about what the mortality is as research is done and as they follow this epidemic moving forward. It's clear, I think, that the virus is more dangerous for people who are elderly relative to people who are younger, and it's more dangerous for people who have other underlying medical conditions that put them at risk of problems if they get infection with the coronavirus.
You know, I've seen people wear a lot of masks as I travel across the United States, whether it be via airplane or wherever. Should they be wearing masks? Is that a good idea?
So healthcare professionals need to be wearing masks, and there's recommendations for what sort of personal protective equipment they should wear in caring for people with coronavirus. The CDC does not recommend people who are out in public who are not ill wear a mask to protect themselves. They do recommend that people who are ill or have symptoms wear a mask to help prevent potential spread to other people.
When it comes to packages that I might be getting from different parts of the world, should I be concerned? Is the coronavirus on that? What do we know about the coronavirus and how long it might live on a surface?
I think they aren't really sure yet exactly how long it can live on a surface in a form that can transmit to other people. I don't think there is concern about packages from other parts of the world, for example, but I do think in terms of keeping surfaces around you, like your school desk or other places clean and washing those frequently is a good idea.
Now, the audience that, and you've already mentioned this, that's impacted the most from it is an older audience or those that are already sick or have certain ailments. But it's not just that audience. It can impact anyone, right?
I think anyone is able to get infection with the coronavirus, people of all ages. I think we're going to learn more about its ease of which it affects younger people versus older people. Certainly it appears the impact or the danger for the virus is higher in people who have underlying medical problems or are elderly.
Now, is this virus normal? Do we see these kind of viruses pop up, or are they created by someone, the government, and then released into the communities that we all live in? Is it something that's natural?
I think like with flu virus, for example, there are changes in the flu virus that occur on a yearly basis, partly because the flu virus can infect not just humans, but other animals and things like that. Sometimes there's sharing of the genetic material between those viruses. So I think the coronavirus is very similar to that. I think this particular strain is a form of the virus that has not circulated in the human population before, and it probably picked up some genetic material or some components of coronavirus that was circulating in other animal populations. So yes, I think it's a natural occurrence to have different strains or new forms of viruses appear, such as this.
So they evolve or change over time, and that means we have to adapt to that, right, at the end of the day?
And I think when we're exposed to these new viruses, we do develop some immunity and some protection to it, and you know, hopefully they're going to be able to manufacture and develop vaccines not only that will offer at some point protection against this particular strain of coronavirus, but future strains that might emerge.
What about these home remedies that keep popping up on social media? Things like eating garlic will prevent coronavirus. You shouldn't be believing any of that, correct?
I'm not aware of any home remedies that actually offer significant protection against the coronavirus. I think people should focus on hand washing, staying, they talk about social distancing, being, 6 feet or more away from people who might be ill. Frequent hand washing, not touching your eyes, your nose, your mouth, keeping surfaces that you may be coming in contact with that could potentially be contaminated with coronavirus or even other viral pathogens, making sure those are cleaned and washed frequently.
But at the end of the day, should I panic and go buy a ton of toilet paper and hand sanitizers, and the list goes on? At the end of the day, should I be really concerned and panic to the point to where some of the things that are going on are happening?
I don't think people should panic. I think the individual health risks remain small for most people. However, I think they need to be very vigilant at their own personal protection approach, hand washing, those things that we've discussed. And I think they need to be paying attention to the recommendations that are coming out from the public health authorities, but I do not think they need to panic.